It's good to see everybody back. I know we were out on July. I know we've seen some of the folks here during the committee meetings, but it's really nice to have you all come back together again. Just some quick housekeeping notes. First, this meeting will be recorded, as we want to make sure that everyone will have access to this meeting after night. This meeting will include interpretation in Spanish and Vietnamese. Gracias and welcome to our interpreters for today. We have Aida, Carolina, Quinn, and Han. Thank you for coming tonight. To access the interpretation in Spanish and Vietnamese, please click on the interpretation button on the bottom of your Zoom screen and then select the appropriate language. In addition, the interpretation for all of you is set to off, so that even if you want to hear the English channel, we do recommend that you click on that interpretation button and you click on the English channel. We do have two videos, one in Spanish and another in Vietnamese, that will play right now.
Hola y bienvenidos a esta reunión. Para acceder a la función de interpretación, haga clic en el icono del globo en la parte inferior de la ventana de Zoom y selecciona el idioma que desea. Para escuchar claramente el audio de interpretación, le recomendamos que también seleccione la opción para silenciar el audio original, que es la opción más baja en el menú después de hacer clic en el icono del globo.
Xin chào và cảm ơn quý vị đã tham dự buổi họp ngày hôm nay. Để truy cập vào phần thông dịch của ứng dụng Zoom, xin nhấn vào biểu tượng hình quả địa cầu ở phía dưới của màn hình và chọn ngôn ngữ theo ý muốn của quý vị. Để nghe rõ lời phiên dịch, chúng tôi khuyến khích quý vị chọn chức năng tắt âm thanh gốc nằm ở phía cuối trong phần tùy chọn của biểu tượng quả địa cầu.
Great. Task force members, we ask all of you to rename yourselves on Zoom if you haven't already by your first and last name, and to also add your organization name so we can ensure that you're identified as a task force member. All you have to do is click on find your image, click on the three dots on the top right, click on more, and then rename. If you are an alternate, yet still have your primary representative in attendance tonight, please add alternate to your title. That would be helpful for us when we take votes on any action. This meeting is open to the public. Saludos to all of you here. Thank you so much for being here. You'll be able to see and hear tonight's meeting, and you will have the opportunity for 2 minutes time to share your voice and comments during the public comment portion of the meeting, which is going to happen towards the end of the agenda. Until then, we appreciate your patience during the rest of the meeting. And then for task force members, there will be time after each section of the agenda for questions. And we ask task force members that if you do have a question during that time, to use the raise your hand feature found below on your Zoom screen, and we will we'll announce your name so you can unmute yourself. I believe that's it. Hand it off to you, Rosalind.
Great, thanks so much, Carlos. Good evening, everyone. Rosalind Huey, Deputy City Manager, part of the COVID-19 recovery team here in the City Manager's office. Just want to welcome everybody, and as has been our custom, we like to start our task force meetings each time acknowledging that we are on the ancestral lands of the Ohlone people. We pay respect to their elders, past and present, and we give thanks for their sacrifice and examples of humility, stewardship, and resilience. So with that, I'm going to do a quick review of our agenda for this evening. And as I do that, I'm going to have to apologize beforehand. I have a family commitment that I need to tend to this evening, so I'm going to have to jump off about 6:30 and hoping to rejoin you, but I know it's really going to be a great conversation and dialogue this evening. We'll start off with some brief task force updates. We've got two main portions of our agenda this evening. The first one is an update on our community engagement and outreach. And then we have a panel presentation, our Committee on Workers' Health, Safety and Rights has put together a group of panelists to share with you all this evening. So really looking forward to that conversation. And then as usual, we'll wrap up with public comment and next steps. So with that, we'll jump right into task force updates that we want to share with you real briefly. So just want to share that the City Council did approve the fiscal year 2022-23 budget on June 14th. And just wanted to share a couple of highlights from that. We've previously shared with you that the city received $212 million of American Rescue Plan Act funds. And in this year's budget, the 22-23 budget, there was roughly about $60 million that had not yet been appropriated, that has now been appropriated with the official approval of the city budget. So with that approval is the $2 million that has been allocated for the task force recommendations that will be coming to City Council later this year. And also just wanted to highlight, because it's a significant amount of money. So there is $10 million that's going toward Beautify SJ and encampment services. There is $11 million for children and youth services, $4 million set aside for small business recovery. And I think really important, $18.5 million that's going toward emergency housing, which we know how critical it is to house our unhoused residents here in the city. So that's the update on the budget. Good news to share with you that we are actually able to continue meeting virtually for the rest of this calendar year, and our work ends in November. So that's, I think, good news for all of us. We'll have the convenience of meeting virtually. And then we want to share with you about, because we are winding down our work. We have a couple of months left before we prepare our final report to the City Council. So just wanted to give you an idea of the main topics for the remaining meetings. And actually for our next meeting in September, we are recommending to the task force that we actually move that meeting out either to September 15th or September 22nd. First of all, the 8th is, we realize it's the week of the Labor Day holiday, and we know that many people do take time off during that time, but even as important as well, the city team and our consultant team will be wrapping up a report on all of the engagement activities that have occurred during the summer. And it would really be helpful for us to have a little additional time to get all of those findings together and present that information to you during the September task force meeting. Our October 13th meeting would be focused on reviewing all of the draft recommendations from all of the committees. And then we anticipate our final task force meeting on November 10th, which would finalize all of the recommendations, and we'll be ready to then submit that report to City Council, which we anticipate that they would consider that report in December. So before we do move on, we would like to take a vote and get comment feedback on post or rescheduling the September meeting to either the 15th or the 22nd. I think it's important that we do take a vote on that matter, just so everyone is clear. And Carlos, I want to make sure, it appears that we do have a quorum, so we'll probably be able to take a vote at this time after discussion.
I am working on counting whether or not we have a quorum. I think we have 25 members, I believe. So I think three members short of a quorum.
Okay, well, why don't we do this? We can certainly take comment, feedback from the task force members, and we can take the official vote at a later portion of the meeting. So with that, any comments? I see Dr. Dewan, you have your hand up.
Yes. Hi, Rosalind. I just wanted to lend my support to this idea of rescheduling. I think it's important to give the city team the time you need to pull the report together. And I would be in favor of rescheduling the meeting if that's what's best for the success of the project.
Great, thank you. Trying to see if there are any other hands.
The Araceli?
Oh, Araceli, yes.
Can we have one of the interpreters move into the English channel? Who do we need to unmute? Oh, okay. Araceli, you are no te podemos oír. Araceli. Okay, sigue Araceli.
Sí, no puedo escuchar nada. ¿Sí me tocaba hablar?
Sí, sí le podemos oír. Araceli, puede seguir.
No se escucha, Carlos, solo veo que mueves tu boca.
Sí, sí. Okay.
Qué raro.
Araceli, sí te podemos oír en el salón de inglés. Nomás sigue hablando y te podemos oír.
Perfecto. También solo quería decir que estaba de acuerdo también en reagendar. Y también si nos iban a compartir como lo que nos acaba de compartir sobre el budget que se aprobó, si nos iban a compartir las definiciones por escrito, cuánto se aprobó para cada cosa que nos compartieron ahorita. Es todo.
Thank you, Araceli. So I believe the question was that I believe you mentioned that you're in support of the meeting change, but that in regards to the $2 million, you had asked about whether that's already been itemized or been distributed. And I don't know, Rosalind, if that's something that you can answer, or if you
well, I was thinking the question was more about the $60 million that was appropriated in this budget. And I rattled off several categories. We're happy to put all of that in writing so that all of the task force members can get that information. So we will do that in a follow-up email to you.
Thank you, Rosalind.
Great, thank you.
Gracias.
Muy bien. Dolores, I see your hand up as well.
I do. Thank you. Also want to echo Dr. Dewan's comments. I definitely support changing the dates. Is there any possibility, even though we don't have a quorum, to just take a quick thing about which date would make sense? And then once the quorum is here, we could take a vote? That it would help the time.
I think that's a great idea, Dolores, to help facilitate, the decision. Thank you for that.
Thank you.
Great. Ben, I see your hand up. Well, we can take maybe a roll call on whether or not it works for folks, but want to make sure that I'm asking if you have a comment.
Yeah, just a question for staff before that in terms of compiling the information, would it make a difference in terms of staff's workload and if it was the 15th or 22nd, are either of those dates preferable in terms of making sure you have enough time for compiling all the results and putting stuff together?
Yeah, thanks so much, Ben. That's very helpful. We anticipate that one additional week would be enough time for us, so we would be fine with September 15th. We just recognize that many of you are involved in lots of different meetings and just wanted to have an alternative date just to be sure that we'd have a date that works for most. But September 15th would work for the city team.
Yeah, thanks, Ben. Derek, did you have a comment?
Yes, thank you, Carlos. Just that I'm in support of the September 15th date if we're taking a preliminary vote.
Yeah, let's go ahead and do that then. So if primary representatives, primary task force reps, if you want to use your raise your hand feature to give us a indication of whether or not this works for you, that would be appreciated. And maybe your accounting is wrong, and we do have a quorum.
So we're voting on the 15th. Is that what you just said?
Right now, raise your hand if if moving the date from September 8th to September 15th would work for you.
Carlos, I apologize. I can't seem to raise my hand at the moment, but either date works for me.
Okay. Yeah. I do see, I mean, if we do add you, Dr. Dewan, I see about 17 folks, 18 people whose date it would work. So let's go ahead and everybody who has your hands up, let's lower them, and then we'll ask folks who to raise their hand if it does not work for you. I'm going to lower your hand, Kira, if that's okay. So if it does not work for you, I think Frederick, you had talked about city dance, so understandable. If you can raise your hand if the move would not work for you.
Are we voting on the 15th or the 22nd, or either or?
This would be keeping it to September 8th.
Oh.
No, 8th or the 15th?
15th.
Yeah, raise your hand if the move from September 8th to September 15th would not work for you.
Yeah, so September 15th does not work for you. You can raise your hand.
I did.
So I see we have 6 people. So yeah, we're still a little under the quorum, the necessary 28 to make a vote. So I think we can wait a little bit, and then well, it looks like we need about 4 more task force members to jump on to help us kind of formalize this.
Yeah. So what we can do perhaps after the next segment of the agenda, hopefully we'll have a few more people, we'll have a quorum and take an official vote. But it looks like so far that the 15th works for most. But we'll come back to that. Sounds good?
Can you try a vote on the 20th and see if that works?
22nd, yes.
22nd, yeah.
Certainly.
Okay, so everybody lower your hands, and then we'll take a vote to see if September 22nd would be a better option for you all. So raise your hand if September 22nd would work for you.
Carlos, again, this is Dr. Dewan, and the 22nd would work for me. It would be a yes.
Okay, thanks, Dr. Dewan. So it looks like we got a tie. We would have 18 members who would also agree that the 22nd would work for them.
Do we want to see real quickly the 22nd if it does not work for folks real quickly?
Good point. Yeah, so everybody lower your hands. Thanks for working with us on this. All right. I think, do I have everybody? I want to make sure we have all hands lowered before I ask the question. So if September 22nd would not work for you, please raise your hand. Okay, looks like 4 people it would not work for them.
5.
That's odd. Oh, 5 people. Looks like maybe we're missing a vote from somebody, because now there's only 23 people total versus 24 for the original vote. All right, well, I guess
it's either way.
It's either way.
Yeah.
I think September, just looking ahead, we would want to make sure that when we present the communication findings, that we give ourselves as much time as possible to work off of the results of the report. So so I think if both dates work for folks, and maybe September 15th would still be the preferred date, to make sure that you all have more time to respond to the and incorporate the findings from the community engagement into the report. But that would be staff's input on if both dates work.
So Carlos, I suggest that we go with the city recommendation because you know what you need.
So then right now we're waiting for maybe 4 more task force members to jump on who it would work for the September 15th, and then we would and then we can make that vote then again.
Thank you.
Thank you for that, everyone. I know that took some time, but we appreciate it. Just want to find a date that works for most. And at this time, if there are any members who have announcements to share with the group, any activities that you would like to share with anyone. I know that we sent an email out with some activities noted, but if there are other announcements, please feel free to raise your hand and share now.
And Monique, I don't know if you have your hand up from prior or if you had an update to share.
Oh, sorry, lowering it. Thanks, Carlos.
Mm-hmm.
Okay, all right, great. Well, with that, I think
looks like Derek.
Sorry.
I'll share. I had visited a few national night outs across the city, and everybody seemed to be having a great time. Great turnouts at everyone that I attended, and it was a good community activity, getting people, diverse groups together, and just fellowshipping and enjoying each other's company and the different festivities.
Great, thanks so much, Derek. Appreciate that. There was a lot of activity that night, yeah. Okay, anyone else? Okay, with that, we'll go into the next segment of the agenda, which is an update on community engagement and outreach. And Carlos, I'll turn it over to you.
Yes, thank you. Well, I'll be presenting this section of the agenda. Normally, we have one of our chairs from the community engagement, but unfortunately, Patty Diaz and Araceli Gonzalez are unable to attend tonight, so you have me. But this summer, we've been together with you. We've been implementing the strategies of the task force's community engagement plan, and we wanted to share some updates and preliminary findings from this work to help you and the committees further refine your draft recommendations. So next slide. So first, we wanted to give an update on the lived experience group, which is a key strategy of the community engagement plan. Our 10-person lived experience group was to carry out 3 community activities each, or events each, this summer, and connect with community members in San Jose who are still experiencing the impacts of COVID-19 and hear what support they need. We're happy to share that that the group was able to complete 25 activities where they connected with and heard from an estimated 1,400 people. These events, as you can see in the photos, included focus groups, virtual and in-person forums, pop-up tabling, pop-ins to existing meetings, one-on-one interviews, and walking tours. Some of the organizations that they worked with to connect with the residents included the School of Arts and Culture, Latinos United for a New America, or LUNA, Goodwill Silicon Valley, the Alum Rock Santa Clara Street Business Association, Sacred Heart Community Services, Parents Helping Parents, and SEIU 2015, just to name a few. These organizations helped ensure that we connected with small business owners, parents of children with disabilities, high school and college students, the unhoused, healthcare workers, the LGBTQ community, and the African American, Asian, and Latino and immigrant communities, just to name a few of the communities that we met with. So in these last few days of our outreach, we'd like to continue to reach out to some more important groups, namely senior residents, the Vietnamese community, arts and cultural workers, and unhoused residents. We just want to make sure that we round out and get as much input as possible from these groups, despite the great outreach we've already done. If there are any meetings or events that you know of where we can maybe pop in and help facilitate a conversation with these groups, please let us know. I know that on this coming Monday, we're working with the Arts Commission to facilitate a conversation and be able to get some more input from arts and cultural workers through that meeting. So, so we're looking forward to that. Next slide, please. So you can also help steer these communities to our upcoming Community Resource Fair, which is happening next weekend on Saturday, August 20th. Thanks to the leadership from the Community Engagement Committee and many of you, we have a great program lined up that aims to connect workers, families, and businesses with the resources to help them recover from the pandemic and give attendees the opportunity to hear and share their stories of COVID-19 resilience. So we have about 20, I think 22 now city departments and local organizations, including many of you who will have a resource table, sharing resources such as mental health services, resources for arts and culture workers, employment assistance, homeless prevention services, info on after-school care, childcare programs, free food assistance, tech assistance for small businesses, and more. So we have some really great resources that we'll have available to the public. This is going to be primarily an outdoor event, and there will be free food and free resources that include COVID-19 testing kits, bike helmets, period products or hygiene products, the San Jose Library's maker spaceship, and not to mention the playground that's right out there, right outside, front and center for youth and families to enjoy. We're going to be having a resume building workshop thanks to our Work to Future team here in the city. And I'm also excited about a performance by Mormas Marami, which is a local theater company who will be performing 2 interactive short theater pieces related to local residents' pandemic experiences. We'll have members of our Live Experience group share some of their stories of how they and their community have become stronger during the pandemic. And we'll have a team of folks going around the event to also capture those same stories from people participating. So we want to make sure that we're capturing stories from attendees as well. San Jose Jazz Boombox Truck is going to be there. And we have a local DJ, Chale Brown of Ungrammar, who's going to be on hand to provide musical entertainment. So thanks, Kira, for the recommendation. So we have a goal of having 500 people come to this event, and people who are in need of these resources. So this is where we need your support. I know yesterday in our email, we shared links and language to share this information with your community via e-newsletter, email, or social media. We have thousands of flyers in our office, and we're ready to hand deliver them to you to your office or event as soon as tomorrow. We're also in need of volunteers to help set up, with setup or breakdown, and staffing our recovery task force resource table. We're going to be sharing, highlighting our survey at the tables, and we also have a need for MCs, primarily folks who are bilingual and can engage with people in either Spanish or Vietnamese. The MCs aren't going to have to speak too much. It's just going to be periodic, every half hour, sharing with people some of the activities that are happening right then and there. So it's not too much of an ask to be an MC, but we would love to have one or two of our recovery task force members to volunteer and step up. So if you are able to volunteer for the event or have any needs to help you promote this to your community, please let us know in the comments portion in just a few minutes. Next slide, please. So we wanted to also share, as promised, some of the preliminary findings from the community engagement that we've already organized this summer, including from two of our biggest community engagement events that we had, which was tabling at Viva Calle San Jose on June 12th at their Baquesto Park Hub. And then the next weekend we were tabling at AXA's Juneteenth Festival in downtown San Jose. Just at these two events, we connected with well over 250 people. And so shout out to Derek for volunteering that day. As you can see on the photo, thanks for helping us engage with residents that day. So next slide. So through a dot exercise, folks were given 3 dot stickers and asked to rank onto a poster board their top 3 recovery resources that were important to them. So as you can see from the pie chart, there were about more than half of the respondents were interested in some of the top 3 items. 23% wanted rental assistance and housing support for residents. Nearly 17% wanted to see health services and resources, including mental health support. And 13% wanted access to affordable, equitable, and quality childcare, early care, and youth programs. So again, those were the summary of responses from over 250 people that we received from those 2 events. Next slide. We also wanted to share some of the preliminary findings from our community survey. We want to reiterate that with the information that we're going to be sharing are still preliminary findings, as the survey is still alive and there's more analysis needed for some of the questions, including some of the text responses that were part of the survey. So next month, we'll be sharing the full report to the task force in September. But we do hope that some of these survey findings will spark some conversation and help provide additional information as you refine your recommendations. So next slide. So as of last week, we've collected 570 survey responses, which puts us over our initial goal of 500 submissions. So thank you to all of you who have already shared the survey with your community and your organization's network. So thank you so much for helping us achieve our goal. As you can see, the majority of the responses are from English and Spanish speakers. We're still very much in need of submissions from Vietnamese and Tagalog speaking communities. Of course, we understand that members of the Vietnamese and Filipino community have very likely completed the survey by choosing to take it in English, but we do want to make one more final push. The survey is open until August 20th. So we want to make sure that it's available for people to take at our August 20th event. But we really would appreciate if you could help us do that final push, especially to some of our Spanish and Vietnamese audiences. We're getting a little greedy. We got 570, we met our goal, but we'd love to have 1,000 completed by August 20th. And I think with your support, we should be able to do that. So I know we've shared tools and links and language for you to share the survey in prior communications, but do let us know if there's anything else that we can send to you again or support you with to get this information out. Next slide. So getting to some of the survey preliminary results, more than half of the submissions have come from our Latino community, with 18%. Oh, I think we're in the wrong slide. Maybe if you can jump back a little bit. The next slide. So more than half of the submissions have come from our Latino community, with 18% coming from our Asian community and 17% from folks who identify as white. Next slide. I think one more slide before, yeah. So when asked if they were working right now, nearly 35% of the 570 responses said no. Next slide. Of those who are not working, when asked what were some of the challenges preventing them from returning to work, they shared that childcare, jobs that don't pay well, and concerns about COVID-19 are as being some of the top challenges that have prevented them from returning to work. Next slide. So overall, what have been some of the biggest challenges for them during the pandemic? 43% mentioned, or 247 respondents mentioned that staying safe and healthy while having to work was one of their biggest challenges. 38% of the 570 respondents reported feeling lonely, helpless, or depressed as a challenge, as well as paying bills and getting COVID-19 being another one of the top challenges that folks had felt during the pandemic. Next slide. And so I know that we also wanted to gather some stories of resilience, and when asked how their community have become stronger during the pandemic, these were some of the responses that they shared. So they became very invested in supporting local businesses. They began meeting more often with their neighborhood association, where they shared resources and had guest speakers from different organizations. Some of them talked about more empathy and collaboration between their community. Folks were learning how to be by themselves and to take care of themselves. There was more unity as a family because the pandemic left folks with a lot of stress. So folks were becoming more united as a family, and folks were becoming just more resilient, knowing the importance of demanding social services. And they referenced how they were a victim of wage theft, and that they now know where they can go to for support. So these were just some of the responses that we had received in some of the responses of the survey. So I believe, so this was some of the preliminary findings. We'd welcome any comments from the task force around some of the survey response, some of the preliminary responses, or any comments around some of the community engagement that we're still running, including the survey and the August 20th event.
Carlos, just a note, we have a number of community members here to speak on the panel that was supposed to start at 6:30, and some of them do have to leave at 7.
Thank you, Luis. I think that's the next item on the agenda. All right. Oh, wait, I'm sorry. We do have a quick segment on the promotores work that we have. And then Luis, maybe we can kind of start doing some work to see who might be the ones that need to speak a little bit sooner. We can start preparing for that. But unless there's any more questions, unless there's any questions, I don't see any hands raised. I'll go ahead and pass it on to Aurelia, who could talk a little bit about her Promotores program that we're also very excited about.
All right. Good evening, everyone. Aurelia Bailey, also part of the recovery team for the City of San Jose. As many of you know, we've been talking about the Promotores program now for a few months. The City Council actually directed us to do this pilot and implement the Promotores model. Just again, another tool for our community engagement. The Promotores will basically identify recovery needs of the hardest to reach community members by hearing and understanding residents' stories. And then the most important thing is connecting them to our programs and services that are already funded in the city recovery initiatives, and also as well as services provided by some of you that's on this call. Who are the promotores? Promotores are uniquely qualified to address the needs of under-resourced communities because they are trusted members of the community. They speak the same language, share the same common culture, connect in people's homes or places of worships and other neighborhood locations. Promotores are neighbors, parents, youth, seniors. They're also business owners, really having to have the training and also believing in helping others within their community. Who will be doing this work? We have provided grants to 3 nonprofit organizations with existing Promotores programs. So it's Communiversity, Community Health Partnership, and the Sisi Puede Collective. The Sisi Puede Collective is actually made up of 5 organizations, which is Amigos de Guadalupe, Grail Family Services, School of Arts and Culture, and Somos Mayfair, and also Vegelution. So what will the promotores do? They are going to engage and conduct outreach to business, to residents, and other stakeholders. They are going to share existing recovery resources, such as our eviction help center from the housing department, some of our small business recovery from our Office of Economic Department, and then also what the library has to offer with the digital equity, from accessing hotspots to free computer classes. They will also, our promotores will also seek information from residents regarding what are some of the things that, what are some of the barriers why they're not accessing recovery resources. And then, of course, assisting residents in accessing these services. And then the last portion of it is that they're also going to be gathering some of the gaps and what are some of those current recovery programs, what are some of those other missing current recovery programs and services. And then the last thing is that they're going to share the information that we are all doing the work here. After we go to council, they're going to go back to out in the community and then share some of those information that we all have gathered from the task force. I will stop there and move right into the workers' health, safety, and rights.
Really, do we want to see if there's any questions or comments?
Oh, yes, sorry. Any questions or comments in regards to the promotores? Okay, so we can move on to the workers' health, safety, and rights. So tonight, our presentation that was organized per steering committee's recommendation. We will be hearing from a few of our partners that work where the work that they are doing out in the community, educating workers on health, safety, and rights. So I'm handing it off to Luis, who is also a task force member and representing Working Partnership. Luis is actually going to facilitate the portion of this presentation.
Great, thank you. So what we're doing tonight is doing a panel of very short introductions to some of the resources and supports that are available for workers in the community, and also some of the needs that are still unmet and will be needed to be addressed as we recover from COVID. And we're actually not using slides except at the end. So if you wouldn't mind dropping the screen share, we can go right into the speakers and everyone can see them. Great, thank you. So our first speaker is Ruth Silvertow, workers' rights attorney.
I want to thank the Recovery Task Force for inviting us here today. Our goal is to provide San Jose Recovery Task Force members with more understanding of workers' needs, available resources, and how to help their community members access them. 8 years ago, the Santa Clara County Wage Theft Coalition, which I coordinate, had a dream of ending wage theft. We made recommendations in our 2014 report. Fast forward, and San Jose and a number of cities have enacted wage theft ordinances. We also recommended more outreach and education. There's now a collaboration at the county OLSC's Fair Workplace Collaborative, in which VAR, who you will hear from today, POWIS, you will also hear from today, step forward. And I'm of counsel as well to step forward, as is Felwina and Ming. Working Partnerships, the Day Workers Center of Mountain View, the Prosperity Lab, and the Hispanic Chamber conducts robust outreach, education, and training to diverse communities. The OLSC Legal advice line I supervise takes calls in English. I do the English one, Spanish. We have 2 attorneys, Tagalog, Filipino, Vietnamese, Nguyen, and Mandarin Ming. And the number I can't write in the chat, but it's 866-870-7725. There's also the Alexander Community Law Center, where I'm a supervising attorney, which is 408-288-7030. And we do immigration, consumer, and workers' rights. Despite the progress, there are still gaps. Wage theft has continued to explode during the pandemic, and I heard that one of the responses had to do with wage theft. San Jose has yet to enact a responsible construction ordinance to combat wage theft in the construction industry. We don't want another Silvery Towers. We also need to include public works in the wage theft policy for contractors with the City of San Jose, because the Labor Commission is beset with staffing problems and long delays. The city attorney's office that was granted the power under AB 5 to sue businesses civilly who misclassify workers need to file cases, and like the San Francisco city attorney, file civil wage theft cases based on the Unfair Competition Code. Sadly, the Office of Equality Assurance of the City of San Jose, although an absolutely critical enforcement agency, is not on the radar of most workers and even attorneys. A collaboration with the Office of Equality Assurance and the Fair Workplace Collaborative would go a long way in ensuring that workers take advantage of the services provided by this critical agency. Most of the calls I receive on the advice line are about paid sick leave or COVID paid sick leave. And I noticed from the survey, there was a lot of talk about the importance of, taking care of yourself during COVID. There's only 3 days of permanent sick leave in California. Workers have to go to work sick or risk losing their jobs. In San Francisco and Oakland, employers with 10 or more employees get 72 hours paid sick leave. Employers with fewer than 10 employees get 40 hours. And we recommend, and we see the necessity of a similar law in San Jose. Additionally, the COVID paid sick leave, which is a different law, ends September 30th, 2022. However, it only covers businesses with 26 or more employees. San Jose must also reenact, because they once had one, a COVID sick leave policy. It covered businesses of any size. Workers at small businesses are not immune from COVID. So to recap, we recommend the following. 1, enactment of the Responsible Construction Ordinance, inclusion of public works in the existing wage theft policy. That's absolutely critical. Urge the city attorney to file wage theft cases, particularly for misclassification, civil cases. Develop a pilot program in which the Fair Workplace Collaborative conducts outreach and education for the Office of Equality Assurance. Enact a permanent paid sick leave policy like Oakland's and San Francisco's, with 40 hours for fewer than 10 and 70 for 10 or more. And enact a COVID sick leave policy that covers all employees. Thank you so much.
Thank you, Ruth. And next up, we have Felwino Opiso Mondina from the Filipino Association of...
We're hearing.
Okay. Oh. I can hear the interpreter. Sorry. Thank you. First of all, I would like to thank the San Jose Recovery Task Force for inviting me as one of the panelists in tonight's very important conversation. PAWIS, or the Filipino Association of Workers and Immigrants, is a grassroots organization advocating for the rights and welfare of workers and immigrants in Santa Clara County. Although the first members of PAWIS, when it was founded in 2002, were Filipino airport screeners facing workplace discrimination after 9/11, nowadays, majority of PAWIS members are low-income caregivers. Particularly at the start of the pandemic, caregivers were more vulnerable to contracting COVID-19 as early outbreaks occurred in nursing and assisted living facilities. This vulnerability was aggravated by the fact that most caregivers, especially the undocumented workers, lack health insurance and job security. Most of them are also women in their 50s and 60s who have underlying conditions. To help our community, PAWIS, as part of the Fair Workplace Collaborative, launched county-wide PPE drives distributing PPE such as surgical mask, cloth mask, face shields, sanitizers, and gloves to caregivers and even to grocery and retail workers. To this day, PAWIS continues its PPE drives, visiting care homes and distributing not just masks, but also test kits sourced from state and outreach materials about workers' rights and COVID from the county and state. Everywhere PAWIS organizers go, we promote the county advice line, of which I am the attorney answering the calls for the Tagalog and Visayan line. We are also hosting monthly Know Your Rights training with Professor Ruth Silvertow, presenting on wage and hour, EDD filings, the leave laws, COVID protocols, discrimination, and other workplace-related issues. The pandemic has really laid to bear the vulnerabilities of our community. A common issue among caregivers is that even if they want to protect their own health and safety, they cannot afford to take the time off because if they don't work, they will not get paid. The RCFAs or 6 beds and private homes do not give PTOs and or vacation leave to the workers. At most, they only get what existing law provides, the 3 days paid sick leave. Even if they contract COVID between January and September of 2022, they are also ineligible to avail of the supplemental COVID paid sick leave because there are less than 26 workers in their workplaces. Giving the workers, particularly low-income workers like the caregivers, more paid sick leave would be greatly appreciated. Because what is at stake here is the health, safety, and even the life of a human being. Just for example, last Friday, a PAWIS member had surgery because her lymph nodes were inflamed and swollen. She just rested for 2 days on the weekend, and on Monday, despite being on catheter, she drove herself to work. Why? Because she cannot afford to be absent. She has to send money back to her family in the Philippines. Of course, for true economic and community recovery, beyond giving workers more paid sick leave, we in PAWIS are advocating that government agencies address the ongoing exploitation and abuses in the caregiving industry and address the issues of wage theft, human trafficking, understaffing, poor working conditions, lack of health insurance, lack of industry standard, and lack of worker power. Thank you so much for your time.
Okay, thanks, Felwina. Next, we have Philip Nguyen from Vietnamese American Roundtable.
Thank you, Luis, Ruth, Felwina, as well as the San Jose COVID-19 Recovery Task Force and all the community members here on this wonderful Thursday night. My name is Philip Nguyen, and I am the Executive Director of the Vietnamese American Roundtable, or VAR, which is an organizational partner of the Santa Clara County OLSE, Office of Labor Standards Enforcement, Fair Workplace Collaborative, since its inception in fall 2019. In this capacity, VAR organizes and works directly with workers and laborers, particularly those who are bilingual, monolingual, and of Vietnamese descent, by disseminating bicultural resources, as well as by hosting community workshops on workers' rights issues and employers' obligations to ensure safe and lawful workplaces and working environments across the city and county. As y'all may know, San Jose is very well known as the home of the largest Vietnamese American population within the boundaries of one city outside of Vietnam. And when considering impact and recovery with respect to the COVID-19 pandemic, we must recognize that the Vietnamese American community is not a monolith. The core of our work with the Vietnamese American community must foundationally acknowledge both the generational fissures and transitional nature of the community, as our work towards recovery should aim to build bridges transgenerationally, interethnically, and cross-racially. As early on in the pandemic, we noticed the susceptibility of Vietnamese Americans alongside other immigrant and refugee populations to the woes of misinformation and disinformation, which impeded access to vaccinations, testing, and boosters, as well as to information and resources to support economic and financial hardships for community members, many of whom are considered essential frontline workers. We know that the ongoing COVID-19 pandemic has revealed and continues to uncover and exacerbate disparities and inequities of these refugee and immigrant communities and their descendants, not only with respect to labor, but also related to social and economic determinants of health and public safety in San Jose. So in the face of the uncertainty of the COVID-19 pandemic, we have seen firsthand the resiliency of these communities to overcome health and economic obstacles on their own. However, it is necessary that we continue to focus on capacity building and resource allocation so that we may build relationships based on collaboration with community-based organizations. It's also necessary to practice cultural humility and responsivity, which can be exemplified through the employment of Vietnamese-speaking staff in areas of workplace and business development, as well as through precautionary public health message distribution. If we and the City of San Jose can begin with a core understanding of the circumstances for why these refugee and immigrant workers may feel the need and desire to work, or that they cannot afford to take off work even if they are sick, then we can perhaps begin to strategize and act upon ways such as providing paid sick leave protections to prioritize workers' health, safety, and rights. Thank you.
Thank you, Philip. And next we have Elizabeth Reyes from the Fight for 15.
Hi, everybody. My name is Elizabeth Reyes. I am an organizer supporting fast food workers with a 5 for 15 in a union. COVID-19 exposed unconscionable weaknesses in the tools we have to protect vulnerable workers. Fast food workers worked throughout the pandemic. They fed us. We call them essentials workers. But when fast food workers got sick, they were often required to work sick, even in the early days pandemic. Exposed workers were almost never quarantined with pay, even when the rules say there ought to be. Workers often did not have the paid sick days needed, and sometimes were denied the rights to use them. When the workers spoke out, they often faced retaliation. And what is true about the fast food workers is true about all low-wage workers. That is why the work you are doing here is so important, and why we support the recommendation of the community. One recommendation from that commitment was to educate employers about workers' rights and what the consequence might be. We support the proposal. Another recommendation is that workers need more paid sick days. We very strongly support them recommendation as well. 3 days is not enough. Lastly, the City of San Jose needs a strong enforcement agency with all the resources that they need to ensure the workers' rights are protected. Thank you for your time and this opportunity to talk with you today. Thank you.
Thank you, Elizabeth. And I know Guillermina was going to speak in Spanish. Is she available?
Sí.
Guillermina?
There she
Hola.
Sigue, Guillermina.
Hola.
Ya.
Guillermina,
¿Me escuchan?
Sí, la escuchamos,
Sí,
Guillermina. Sí.
Sí, Guillermina, sigue, por favor.
No se escucha.
Guillermina, sigue, sí te podemos oír.
Oh, ya, ok, es que yo no escuchaba. Ok, mi nombre es Guillermina Blancas, trabajo en Winchester, en San José, California, por más de 10 años, casi voy para 23. A mí en enero me enfermé del COVID, me enfermé en la tienda y yo iba a trabajar así enferma, con dolor de huesos, calentura, y simplemente las manejadoras me decían que era una gripa, que tenía que estar yendo a trabajar. Entonces, pues yo seguía yendo. Entonces, un martes fue la de Recursos Humanos a hablar conmigo y ella me notó enferma y me mandó para mi casa a descansar, que me hiciera el test del COVID. Entonces, pues yo salí mal del COVID, pero cuando ya estuve en mi casa no me pagaron los días de enfermedad, nada más me pagaron 22.50 días, que porque no me podían pagar más, que me lo iban a dejar para después. Entonces yo tuve que pedir un préstamo que todavía estoy pagando, culpa de eso, de que no me pagaron todas mis días de enfermedad y todo eso del COVID. Y por eso yo pido que, y estoy aquí en la lucha por 15 para que pase el AB 257, para pues que nos apoyen a que nos paguen días de enfermedad, a vacaciones también, porque nosotros tenemos que tener vacaciones como trabajadores igual que ellos, y que nos hagan caso, que nos escuchen cuando nos damos una quemada, cuando nos pasa algún accidente, porque yo me han pasado accidentes en la tienda y no me han puesto cuidado hasta que yo me voy al hospital. Y por eso estoy en la lucha de AB 257 para que pase. Eso es todo lo que pues yo digo, y pues ojalá y pase la ley.
Gracias, Guillermina.
Thank you, Guillermina. Muchas gracias por compartir su experiencia. And our last speaker is Armando Ricardes from Prosperity Lab, which supports and provides resources to small businesses to understand how to comply with workplace health, safety, and workers' rights. However, I believe that Armando had to leave, unless I'm not seeing him. Armando, are you still here? Well, I'm afraid he had to go, but Prosperity Lab and the Hispanic Chamber are also two great resources that really work hand in glove with the workers' rights organizations you just heard, to also provide resources and education to small businesses who may not know what their obligations are or know how or whether to comply with them. So they're a very important part of the partnership. And finally,
I did want to add that the advice line is for both employers and workers as well. So employers can call us. Sorry.
And we can send that advice line out with the notes, I think. If you can pull up the PowerPoint again, please. Next slide. Right. So to close out, you've heard some of these discussed on the panel, but just to give a preview, these are the 3 draft strategies that the Workers' Health, Safety, and Rights Committee has developed so far, focusing on what are those gaps that are still needed by working people in the city of San Jose. So the first is to expand outreach and education on workplace rights, both to expand the city's role and to connect with other agencies and community orgs, including those like you heard from tonight, to be able to leverage and increase existing capacity. The second is to strengthen workers' rights and safety enforcement tools at the City of San Jose, and we have some legislative and policy proposals along those lines. And the third is for the city to provide paid sick leave protections, both stability and predictability in COVID-19 paid sick leave, because although we are recovering, it looks like COVID is going to be with us for quite a while. And 2, permanent local paid sick leave law, because we all know that 3 days a year of sick leave is not enough. So next slide, please. And so now we'd like to turn it over to the task force members for any questions you have of the panelists or any responses you have to these three questions. So questions for the panelists or responses from the presentation you just heard. What are you excited about? What are your curiosities or concerns? And what are your thoughts on the three priority strategies?
Dolores, go ahead.
Hi, good afternoon, and thank you to the panelists. It was very inspirational and moving and educational, all the information. My question is, I guess to Ruth, on the proposal, which I think is great to expand or increase the number of days of sick leave. In your definition of sick leave, does that include family, and how is that defined?
Yes, you can take time off now under the state, but it's only 3 days for your own illness and also a family member's illness. Mm-hmm. And family members is really defined pretty broadly. Parent-in-laws, parent, grandparents, siblings. So it is children. So it's pretty broad, but it is both for your health and your family.
Okay, thank you.
We just want more days, the way they have in Oakland and San Francisco. Yeah.
Right. I get it. What about bereavement leave? Is that something?
That would be lovely. They're trying it. They're trying to get it. The community groups locally and also at the state level as well. But cities are stepping up, but that would be helpful to have that.
Thank you.
Any other questions from the committee members? All right. And I believe you have your next committee meeting, Luis. If any of the community members wants to join us, your next committee meeting is on September.
Yeah, I believe it's Monday, September 12th at 10 a.m.
Right.
And we'll be finalizing the recommendations then. So any task force members are welcome to attend.
Great. Thank you, Luis, and everyone in the panel. So with that, I will hand it back to Carlos, or I believe.
Yeah, so I can follow up. I know that we wanted to close the circle, the loop on this rescheduling of the next task force meeting in September. I don't think we've had a change in or any more additional task force members jump on. So I wanted to throw it out to the task force if you would be okay with or comfortable with just a general consensus vote on moving the date from September 8th to the 15th.
Yes, I support that, Carlos. Derek Grass here, Black Leadership Kitchen Cabinet. I think it's a good idea to see if we can find consensus for the 15th.
Yeah, I'm fine with 15 also.
Thank you, Sam. Dr. Dewan?
I agree. I think consensus, the majority indicated they were available and city team said they could be ready by the 15th. So I would support that as well.
Okay, thank you, Dr. Dewan. Dolores?
Yes.
Thank you. So, I mean, I know we've already took a vote. So is there anyone that's not comfortable with a general consensus vote? Otherwise, I think we will just accept the initial vote that we took earlier of the okay to move to September 15th. Okay. All right, everybody. Thank you so much. And we look forward to sharing the results of the community engagement on September 15th. I think we will move on to the final stage of our meeting tonight, which is the public comment portion of the period of the meeting. So if there are members of the public who have a comment, to please raise your hand and we'll call on you. You'll have 2 minutes to speak. Lan, go ahead. Thank you for attending. You can unmute yourself, Lan.
Can you hear me now?
Yes.
Oh, all right. Thank you, Carlos, and the task force. I just wanted to mention about a event and a suggestion from the small business communities coming from Rotary Club about an event happening next month. And the event is about securing businesses' online presence. And they had a suggestion that we organizers have a gathering place in the city of San Jose where the small business owners can have a comfortable place to discuss together. Therefore, my comment is that is such a resource that is free to the public and especially to the small businesses with an aspiration to grow online is available free of charge to our San Jose businesses. So how can this event be connected with the task force to also help the members and that you are trying to help the same way? So that's my question to the task force.
Thank you
Back
so
to
much,
you, Carlos.
Lan.
I'm done.
Thank you, Lan. Are there any other comments from the public? Okay. All right. Well, I think we can still go to the last slide, Aurelia. So I think we're that's the end of our agenda. So I know there's a question mark there, but it looks like the next task force meeting will be for Thursday, September 15th. We still have about 9 more days of our community engagement. So we look forward to sharing with you some more information around this, getting your support with the survey and with promoting our August 20th resource fair. Please let us know, send us an email if you are interested in volunteering for the August 20th event. As we mentioned earlier, we're in need of folks to help with setting up and breaking down, also with people to staff the recovery, the task force's resource table. And also if we have a couple brave souls who would want to be an MC along with myself and or another member of the task force. And I know we do have ongoing committee meetings and we look forward to continuing to meet with you there. So unless there are any more items that I missed, Aurelia, or if Rosalind, you're still on the call, I think we are good for tonight.